Who would have thought that a gland on your neck could make your skeleton shrink? But that's what the parathyroid glands can do. They're associated with the thyroid gland. They're a major regulator of calcium in the bloodstream, working in a feedback loop with a hormone calcitonin. Here it is. If our calcium levels in the bloodstream drop, maybe we're not consuming enough calcium-rich food, the parathyroid gland is going to respond by producing PTH. This stimulates osteoclasts, which are cells in the bones, to release calcium from that bone. So now the bone's becoming brittle and its mass is decreasing. At the same time, we get this sudden pulse of calcium into the kidney tubules and intestines, and sometimes that's a problem. When there's hyperparathyroidism, there's too much PTH, then we have excess calcium being removed. And I mentioned this, the bones become weakened, brittle, and that sudden pulse of calcium causes kidney stones, affects nerves and muscles. Adrenal glands are perched above each kidney. They're small, but they do a lot. The cortex is the outer part, and it secretes a steroid hormone. One of the hormones is called glucocorticoid, and it's actually a group that includes the hormone cortisol. I'm going to mention a negative feedback loop involving cortisol. Let's say you're stressed. And when you're stressed, your body's going to use glucose rapidly. And you're going to exhaust your glucose supply, and so now it's dropping. When this happens, the body responds with the production of cortisol. And this is going to tell the muscles to break down protein into glucose. Now that seems crazy, but it's doing this because you have exhausted your glucose in the plasma, but your body needs energy. It needs to function. And so it's going to search for a form of energy, and there it finds it in the muscle tissue. Now, cortisol also reduces the use of glucose by muscles, and it's called glucose sparing effect. This also makes sense because your body's starving. Let's cut down on the expenditure of energy by reducing the muscle uptake of glucose. This continues until the blood glucose levels return to normal. Now, this is not something that happens every day. This tends to be a extreme response to long-term starvation. So don't be concerned if you miss a couple meals that your body's going to start breaking down muscle. No. This will go on for days before the body finally reverts to this last-ditch effort. Cortisol also shuts down inflammation, and it is good at speeding recovery. This is one of the reasons that we use cortisone, a type of cortisol drug, in many medicines, from injections, muscle aches, asthma, various inflammatory disorders. Cortisone is wonderful at shrinking tissues and reducing inflammation. The adrenal medulla releases epinephrine. That's the old flight or fight neurotransmitter. What it does is it's going to prepare you for exactly that. Flight means to run away or fight. It does this by increasing the blood supply to the heart and the arteries that lead to skeletal muscles. So suddenly the muscles of your legs are pumped full of blood, and blood's being shunted away from your intestinal tract. Because if you're running away from a leopard, who cares if you're digesting your last meal? That's not so important. Chronic stress. That's a problem many people struggle with. What's happening is cortisol and epinephrine are being pumped in the bloodstream, and it can shock the body because Instead of having a stable glucose blood concentration, we have pulses of it, and so it's high, it's low. And this affects our body in many ways we still don't understand. Certainly it's linked to cardiovascular disease, depression, and immunosuppression. So people under chronic stress, they get sick a lot. This is something we can avoid through lifestyle management in many cases. We're not prisoners of war here. We have some options and some choices we can make. Pineal gland, I like the pineal, embedded in the brain, sometimes called the third eye. It secretes melatonin hormone, and it does this when light levels are low or when they're absent. It's going to affect neurons that lower the body temperature at night, and they're going to taper off near sunrise so that our body temperature rises. So it all influences our biological clock. People that produce melatonin during the day often suffer from SAD, which is seasonal affective disorder, the winter blues. This is because their biological clock is out of sync with the changes. It can be treated with exposure to intense artificial light during the day, and this will tell the pineal gland to shut down melatonin production. Sometimes these are called happy lights. What some people do is they will watch a movie or they'll work on their computer late at night, and that light tells the pineal gland, hey, it's daytime. So here it is, midnight. They finally stop their movie or their computer. They flop in bed and they're wide awake because they have very little melatonin. They would have been better off stopping earlier, sitting in a dark room, maybe stretching, praying, preparing for bed, and letting the melatonin flow into the bloodstream, lowering the body temperature, preparing it for sleep. Pancreas, we think of blood glucose concentration when we think of the pancreas because it has these beta cells that secretes glucagon. And if you recall, glucagon is going to cause the liver, and actually cells in the muscle as well, to break glycogen. Glycogen is just a bunch of sugars mashed together in a tight package. You're going to break those into glucose. This is the way we maintain our blood glucose levels, so between meals we don't just like collapse. We have our own natural energy drink in the form of glycogen. The beta cells are going to release insulin, which is needed for cells to absorb glucose. You see, without insulin, glucose just remains in the plasma. It doesn't go into cells, which is what powers our body every minute of our life. In diabetes type 1, we're often dealing with a pediatric patient who has defective genes or had a lysogenic virus infection or an autoimmune disorder, something that has caused the beta cells of the pancreas to become ineffective. Type 2, in reality, there's many different types. This is just a convenient category. This is when the beta cells decrease their production of insulin with age. It doesn't have to happen this way. It's sometimes genetic, and it may be just excessive intake of simple sugars. And over time, we can cause a glucose intolerance where cells just, some cells quit responding, and then other cells of the body, such as the brain, carry on. So we have differential absorption. This can sometimes be avoided just with a lifestyle change, decreasing the intake of those simple sugars. Ketoacidosis is a disruption of blood pH, and I'll explain how this happens. If there's a low concentration of insulin, then high concentrations of glucose in the blood result. I hope that makes sense. Without insulin, glucose cannot flow into cells. So those poor cells, even though they're surrounded by glucose, they're not being fed. The glucose in the plasma becomes toxic, and so the body attempts to shunt this glucose to the kidneys, and it's a compensation activity where the kidneys are going to produce excessive urine that's loaded with sugars, one of the symptoms of diabetes. An autometabolic pathway sets in. If you recall, the cells are surrounded by glucose, but none of it's flowing into the cell because there's not enough insulin. So they're starving, and they're having to switch to metabolizing their own structural fats and proteins just to stay alive as a source of energy. The result of this is ketones. These are acidic metabolic byproducts when cells start to digest themselves. And this causes the pH to drop, which means become acidic, and we have a life-threatening situation. Rebound hypoglycemia is something we can avoid. It starts with the consumption of simple carbohydrates. So someone has a donut and maybe a latte, coffee with lots of sugar. This is going to elevate glucose levels in the blood, and the body's going to respond. The pancreas is going to make lots of insulin. And so we have this rapid absorption of glucose by the body tissues in a stage called hyperglycemia. Some emotional mood swings we see are the patient becomes very excited, they're nervous, they're hyperactive, they're very excited, the world looks great. Isn't life wonderful? Unfortunately, hypoglycemia follows hyper because it's a rebound. The high levels of insulin have caused glucose to be absorbed in the tissue so fast that suddenly this source of energy is gone. And the glucose is what was fueling this whole reaction. The result is, well, the cells are becoming starved. Emotionally, they're irritable, they're depressed, they have headaches. And if they're wise, they'll stop this rebound business by having a turkey sandwich or some complex carbs or something that will stabilize. But more commonly, when the crash hits, people reach for that energy drink or that sweet something, and up they go again until the next crash. This is one you can avoid. The one problem with hypoglycemia, though, is it can develop into insulin shock. Because if you recall, insulin helps the movement of glucose into cells occur rapidly. And when glucose concentrations in the plasma are low, the brain and other body parts are starved. And this can be a life-threatening situation. So keep yourself balanced. All right? You'll be amazed at what a low-sugar diet will do. It's incredible. Ask me sometime. Good summary here. Parathyroid, PTH. That's the one that stimulates osteoclasts to start pulling calcium right off of our bones. Hyperthyroidism, too much PTH. We end up with problems with the bones, stones in the kidneys, and so forth. Adrenal glands, these are perched on the kidney. They produce steroids such as the glucocorticoids or cortisone I talked about. And this is when we have a reaction of rapid uptake of glucose, and then our body tries to do a sparing reaction said, hold back, hold back. Neurotransmitters such as epinephrine cause the flight or fight. I mentioned the chronic stress syndrome with excessive cortisol over time. Pineal gland. This is the one that produces melatonin when conditions are dim. It affects our biological clock. We have that SAD, or seasonal affective disorder, when we're getting too much melatonin during the day. The pancreas has alpha cells that release glucagon. Remember the 2 G's, glucagon, glycogen, 3 G's, and glucose. So the way we release glycogen from glucose is via glucagon hormone. Work that one out. You'll figure it out. Beta cells, insulin, glucose absorption and regulation. Diabetes type 1 tends to be autoimmune, pediatric patients. Sometimes the white blood cells destroy those beta cells in the pancreas. Type 2 tends to be adult onset, may be related to dietary sugar consumption. Ketoacidosis, that's when our cells are metabolizing their own fats and proteins because they're not getting sufficient glucose. Can be life-threatening as ketones increase the acidic, or lowers the blood pH. Rebound hyperglycemia, this is one that's controllable. It's related to dietary intake of carbohydrates, followed by the crash or the hypoglycemia. And shock, where glucose-starved cells especially are affected in the brain.